based on the data, are the most vulnerable people in the classroom as the teacher. Any faculty members, the principal, et cetera. Again, it's certainly age reliable when it comes to who gets the infection. So I know that we need to make sure that we're more consistent. I think part of the concerns I hear from the teachers is we had rules in place that have not always been followed as we understood them to be.
Governor Herbert earlier this week addressing the explosion of positive cases in Utah County. As a result, the county is now under a mask mandate until October 20th. Many of those cases centered around BYU and UVU. The governor urged students to follow the rules, wear masks, and social distance. It's an important message today. Another record day for positive cases here in Utah, more than 1,400. Joining us to discuss this disturbing trend in Utah County, Ralph Clegg, the Executive Director of the Utah County Health Department. Ralph, thanks for joining us on your Friday evening and spending it with us.
You bet. Thank you, Rosie.
Well, Ralph, 530 positive cases in Utah County today. It's very important to slow the spread of COVID-19 with the return to school. So how much has that played a role in the huge increase in positive cases?
Well, certainly with the universities, the two largest universities in the state opening up in Utah County, as well as our K through 12 programs in Utah County, we have seen a surge in the cases. And it's driven largely by the 15 to 24-year-old age group. As they've come back to school, as they've been able to get together and in situations where the virus can be easily spread. And so that age group has contributed to the resurgence of this virus, but again, the biggest concern is that it tends to go out from that age group to all levels of population.
State leaders and health officials pointed to Utah County as one of the hot spots for the recent spike in COVID-19. So what can you tell us as far as what your health department's plans are to help mitigate that increase?
Well, we continue to encourage people to follow the guidelines that have been issued by the governor, the state health department, and by our department, as well as other elected officials, which are also stressing this with their citizens, to make sure you're doing social distancing, wearing a mask. Particularly important to stay home if you're sick and not bring the illness with you, to get tested if you have symptoms, so that if you are positive, you can be isolated and we can slow this disease. We continue to work very closely with our superintendents of the school districts, with our universities, on messaging to those populations which are being affected so heavily with this virus, and we'll continue to do so, as well as you mentioned, we have that masking directive or requirement for Utah County. If citizens will follow that, that will help slow the spread as well.
Now, BYU and UVU, they put in very thorough and detailed plans, working very hard to make sure students who are back in school are safe, but we're still seeing a high number of cases among that age demographic. So what's going on here?
Well, certainly with what the BYU and UVU have done, they've been very successful on their campuses of encouraging students to follow the guidelines, which I think are largely followed on campus. The messaging now is turning to those students who, after they're on campus, choose to go into situations where there is very little social distancing or masking, and trying to encourage them to understand how important it is that they continue to follow the guidelines, whether they're on campus or off campus.
Utah County recently passed a mask mandate this week, and then Provo and Orem were moved back to the orange phase of the pandemic recovery plan. So how do these factors play into your guys' overall plan to fight COVID-19?
Well, of course, we're following the orange guidelines now for Orem and Provo as we work with those cities. Certainly those guidelines have reduced the number of extremely large gatherings that can take place, and even reduce the number that can be in a large gathering. And so we're working with the cities on that, trying to help them. As you know, Provo City has a very stringent masking requirement in place, which we support and try to help them as they educate their citizens as well. And we'll continue to educate their citizens in any way we can.
Right. Well, although the mask mandate is in place, violations are not punishable. County officials did say that law enforcement, they won't be called to places where residents are defying the mask orders. Are you guys concerned with compliance?
Well, there's always a concern with compliance, but we believe that the citizens, as they understand that they're elected officials And those who have been appointed to watch over their health in a public setting are stressing the importance of this through that masking requirement, that they'll respond and they'll understand and they'll move forward and change their behaviors in a way that will help us contain this virus.
Provo High, they originally wanted to move their homecoming football game against Wasatch High to Spanish Fork so that parents and fans could still attend, since that city is not under the same restrictions. But does this defeat the purpose of moving Provo back into the orange phase?
Well, as I understand it, of course, Provo High has changed that, and they have gone back to where they're going to have it at the high school and without spectators. And certainly by moving it out, and if the citizens where we're having some high spread go out, that would kind of defeat what we're trying to accomplish. But I think that the district and Provo made a good decision in what they've ended up doing.
All right, about 30 seconds left. Ralph, what's your message to your community in Utah County?
Well, the message would be really that viruses do what viruses do. And they're very good at spreading disease. And so without a vaccine and without medicine to contain this, what will help us contain this virus is our behaviors as citizens. So essential, very first, that we stay home if we're sick. And if we do have symptoms of COVID, that we get tested so that we can be properly isolated. Our close contacts can be quarantined to help keep the virus under control. And that we need to follow those isolation and quarantine guidelines. And it's also essential then that we practice good social distancing, masking when we can't have social distancing, and practice good personal hygiene in our lives.
It's hard, but stay focused, right? Onward and upward.
Stay, very, very much so.
Ralph Clegg, Executive Director of the Utah County Health Department, thank you for coming in tonight.
You bet. Thank you, Rosie.